Medulloblastoma is a common pediatric malignant embryonal brain tumor which commonly arises from the cerebellum. It is treated via surgical resection, chemotherapy, and craniospinal irradiation. Despite aggressive treatment, 30% of patients succumb. Medulloblastoma is classified into 4 subgroups and is stratified by age, metastatic status, meaning how far it has spread, and the extent of tumor resection, and histology. Recent studies provide an overview of the disease's epidemiology, diagnosis, clinical manifestations, classification, and current treatment strategies. Central nervous system embryonal tumors are the most common malignant group of brain tumors, accounting for 20% of pediatric central nervous system tumors. Medulloblastoma comprises 15% of all pediatric central nervous system tumors and 40% of all posterior fossa tumors, and a whopping 90% of all embryonal tumors. The peak incidence of medulloblastoma is between 5 and 7 years of age, and it occurs more frequently in males with a male-female ratio of 1.7 to 1. Medulloblastoma is diagnosed using clinical symptoms and imaging findings on CT scans and MRI. It often presents with headaches, nausea, lethargy, and ataxia due to increased intracranial pressure and cerebellar dysfunction. Post-surgery, follow-up MRIs are recommended to determine the tumor remnant size. Histopathologic confirmation and classification are performed using an integrated histopathology and molecular studies. Spine MRIs are often performed preoperatively to evaluate metastatic disease. The differential diagnoses include atypical teratoid rhabdoid tumors, ependymomas, pilocytic astrocytomas, and choroid plexus papillomas. The WHO 2021 CNS5 classification of medulloblastoma consists of 4 molecular groups, namely the wingless or WNT activated, the sonic hedgehog homolog or SHH activated, the TP53 wild type, the sonic hedgehog homolog activated and TP53 mutant, and non-WNT and non-SHH. Medulloblastoma is also histologically divided into 4 types, which are the classic, the desmoplastic or nodular, the medulloblastoma with extensive nodularity, and lastly, the large cell stroke anaplastic medulloblastoma. Medulloblastoma was updated to 1 category in the CNS5 classification as medulloblastoma histologically defined. Sonic hedgehog homolog medulloblastoma is associated with desmoplastic or nodular histologic type and medulloblastoma with extensive nodularity histology. Medulloblastoma treatment consists of maximal safe resection, chemotherapy, and craniospinal irradiation. The surgical standard is maximal safe resection with aggressive resection not recommended if it will result in significant neurologic morbidity and delay either chemotherapy or craniospinal irradiation. Previously, medulloblastoma was treated with 36 grays of post-operative craniospinal irradiation with a boost of 54 to 55.8 grays to the posterior fossa due to the tumor's extensive radiosensitivity. Since the 1990s, adjuvant chemotherapy has improved medulloblastoma outcomes. Factors determining prognosis include the CNS disease extent, the age, residual disease after surgery, the tumor histopathology, and the tumor cell characteristics. The modified Chang staging system is useful in risk stratification of medulloblastoma. It's important to note that the treatment goal is to improve the survival rate with minimal additional adverse effects and reduced long-term sequelae. It is necessary to incorporate genetic findings into the standard of care, and clinical trials that reflect this need to be conducted.